Hi, LaSondra. Thank you for joining us today on Like Therapy.
Yeah, thank you for having me.
Okay, so you are a licensed clinical social worker supervisor, and for our listeners, we'll short it to LCSW-S.
Yes.
So I want to get into that. Talk about basically what that's like training the next generation of therapists. Just what it's been like for you going from LCSW to LCSW-S, what drew you to being a supervisor. I want to get into all of that because I feel like it's something that so many people are interested in and they're also intimidated by it or, don't know what it's going to be like or, just don't know what it's like kind of switching in and out of the different roles when you're an LCSW. So let's start off with what drew you to it? How did you feel when you first started becoming a supervisor, and what do you like about it?
Okay. So I feel like what drew me to being a supervisor is my nature to want to teach, to want to help. I feel like naturally as social workers, that's just kind of like in us, you know what I mean?
Yeah.
And I also appreciate kind of how I'm able to stay abreast of everything that's going on
Yeah.
when doing supervision, right? And having to hold myself accountable of knowing all the information. So I feel like that's kind of what drew me to it. I mean, obviously, I get perks that come along with it too, right? I get to make some extra money and things like that. So that's helpful. But ultimately, my ability to kind of help the next, as you described it, generation of social workers, just the same way that I was helped, makes me feel like I'm giving back in a different way.
Yeah.
So,
It's like it touches on all these different aspects, like both of you personally, like teaching, but also of your identity as a social worker.
right.
And what it means to give back, what it feels like. Staying abreast of things in the field, I feel like is so hard because once you get in your role, it's like you just know what's going on there, but not in the larger sense and
Right.
even what's going on within the field of social work.
Right. It feels like you can be almost on autopilot sometimes. Right. And so being a supervisor forces me out of that and forces me to kind of face more of the day to day with other people, as well as just considering, what else I need for my own practice and how I can help them with the things that they're learning and that they're doing with their clients. So it's nice. It's nice because you do kind of get the best of both and staying aware of everything that's going on.
Yeah. Okay, let's start with the teaching aspect because I would imagine it's different types of teaching. Like, partly you're teaching, just, okay, what's it going to look like going from your LMSW to an LCSW? What types of things do you have to think about? And then also kind of teaching or guiding them through their own fears or insecurities or.
Okay, I feel like that's a layered question. So let me try my best to answer it the way that I interpreted the question.
Yeah.
So I'm going to start with what I think is important in terms of where we start in supervision. Because for me now, as a more established social worker, I've learned that understanding myself as a person has become very helpful in the work that I do. But initially, as an LM, I had no idea how important that was.
Yeah.
So I try really hard in terms of teaching to help the supervisees identify their own sort of triggers, their own sort of countertransferences, things that will come up in their own things that they've experienced, and helping them to identify how maybe that may create biases in some of the work that they do. So for me, it's really important to have clarity in who you are as a person, as a clinician, and then being able to kind of translate that into the work that you do. So teaching wise, I guess, to kind of bring it back, that is the first thing that I feel like, hey, I want you to understand what countertransferences are, how they show up in the work that you do, how it can be an ethical dilemma because it hinders like your ability to provide adequate care.
Yeah.
The other thing that came to mind when you asked me that was, it's interesting. So I am in a medical hospital. So it's very different clinically,
Yeah.
right, in a medical hospital. So I have to get very creative with how I can teach medical social workers clinical skills.
Yeah.
And that's that's tough if I'm honest,
Yeah.
right? I literally have to break down what are clinical skills. What exactly? Let's look at them on like in a list, right?
Yeah.
And let's take them and apply them to what you do day in and day out with each client, patient, family that you work with. So that's a very interesting way to have to like teach. Whereas when I was in supervision, I wasn't necessarily doing therapy, but more therapeutic
Yeah.
skills. So it's very interesting.
Yeah. Well, and I like how you described it's almost like in both things that you're prioritizing with the clinical skills and also with knowing yourself and your own triggers and biases, there's these shifts. Like you're going in between, okay, thinking about yourself, knowing yourself, but then back to, okay, how is it just affecting the work or the client? And then also with the switching or not switching, but like what do clinical skills look like in a hospital setting versus when you're, in a therapy room. Okay, which to dive into first?
We can talk about the hospital setting if you'd like. Is that what you mean?
Yeah.
Yeah. No, we can talk about that. Is there anything in particular that?
So when you're talking with them about the clinical skills, is there anything that you feel like is really helpful in the hospital setting?
Yes. So I think especially because of the population of people that we service, right? So the population is predominantly indigent. And I think it requires a lot of patience, a lot of understanding, a lot of empathy, those sorts of things. And so it's one thing to do like an assessment, right? And generally as social workers or clinicians in general, we do assessments. So we talk about that. But we talk about, hey, just because you've seen someone similar to like this description or this how they're presenting, we don't want to make assumptions that everything fits the same person in the same way. So we kind of go through the different skills in terms of how are we reaffirming what they're telling us? Maybe we have someone that's homeless who's been homeless for 3 years, and how are we reaffirming their goal of wanting to establish housing?
Yeah.
What are we, instead of like, hey, here's a list of resources,
Right.
send you on your way.
Yeah.
What are we doing different? Because that is, and then we have we're in an ER. So it makes it even, you know what I mean? Like,
Yes.
we need you out. We need you, you know what I mean?
Yeah.
So really trying to balance meeting the needs of the client or patient and also staying within the guidelines of the hospital. And so I have to really kind of like point that out because as we said earlier, sometimes we're on autopilot. So we don't even realize that that's what's happening and we're just doing.
Yeah.
You know what I mean?
Yeah.
So that's one piece that I find we kind of have to work through in the hospital setting.
And that you guide your supervisees through, like, because I feel like that also kind of ties in with the countertransference or the biases part is like, how can you notice in yourself when you're doing that or when you're starting to just give resources versus when you're really seeing them and reaffirming what their goals are.
And their needs, right? Like, and sometimes, I think sometimes the demands of management, the demands of people above who aren't social workers, because there's lots of different services within the hospital. that can become very difficult. And so being able to set boundaries and navigate that space is also very important. And there's a lot of teaching and clinical skills that come with that. Being able to advocate, right? Not just for the patient, but even for yourself. Hey, this is not within my ethical guidelines. I'm unable to follow this process in this manner. Is there something else that we can look at? You know what I mean? And oftentimes it's scary because that could mean, that could mean maybe you get a write-up. Maybe, hey, if you can't do the job the way we want, you know what I mean?
Yes.
There's lots of things that come with that, but it's very important, obviously, to maintain your licensure, to be within ethical guidelines, and understanding that is a part of, I think, the teaching too.
And see, what's hitting me is like, this is just all the stuff you don't necessarily learn in school.
No. Not at all.
Right? Like and this is what social work is so, I mean, this is part of the reason why, I think we love it, and what it's built for is like, here are all the systems that are happening that are hindering, X, Y, and Z. Here's what we have to work inside of in order to help people as best as possible, or how they want or need to be helped, and not how the system thinks they want or need to be helped. But just that, you're getting the opportunity to really teach, the social workers that want to be LCSWs, not only how do you do that and help other people, but how to use your own voice and potentially create conflict, or even just step outside of like just purely in the helping role.
Right.
Like, how do you do that when all these other
factors are at play?
Yeah.
Yeah. It's hard for me, right? Obviously I've had a little more practice, and I think another thing that might complicate it is each supervisee is different, right? And so I have my supervisees that are comfortable with like, hey, this isn't, what I'm, and then I have my others who are, I want no conflict.
Yes.
Let them run me. And I'm like, no. This is how we get burnt out.
Yeah.
Which is another teaching thing that's so important.
Yes.
And so I'm also finding my way in supervision, and providing supervision, in that I find that this is something else that's important to talk about: work-life balance, setting boundaries, right? Being able to figure out a compromise with, I'm a quiet person, I'm introverted, I really don't want to ruffle any feathers, but I've got to set a line in the sand at some point. You know what I mean? Because if I don't, I'm going to have some real burnout that just really hinders the field in general, you as a person, just so many, it's a domino effect.
Yes.
So we talk about that a lot. That's a big thing. I feel like I'm always talking about like, hey, how are self-care? What are you doing to manage yourself?
Yeah.
And not feeling like you have to do more than what you're even capable of.
Yes.
So I think that comes up.
Oh my gosh. Okay, I want to talk about 4 different things
in
there. So let me see where to start.
Sure.
Okay, so one thing that I think is so cool about what you just said is that it's how connecting, using your voice and like potentially having a hard conversation about your ethical boundaries or starting a conflict actually is connected to rate of burnout or not burning out. Like I think sometimes burnout is just talked about in terms of like, well, don't work too hard or something. Like it's just about the hours, but I think it's also about these what you're doing within the hours and how that creating that conflict might feel so uncomfortable or hard, and also how is it protecting you down the line to be able to keep doing the work.
Yeah.
I feel like it's not always talked about how those things can be connected.
Yeah, no, I don't think. And the hard part, though, Rachel, is that until you're in it, I just don't even know that you can get it. You know what I mean? Until you get to that point, because different people are working for different reasons. And not that, they don't love what they do, but we all have a means to an end, right? And so it's like, until I'm in it and I realize how this is truly affecting me, I don't get it. And so it takes for somebody maybe to point it out for some people because they don't even know that it's a thing. And you're right. When we think about burnout, we think about, oh, you're just working too many hours. We don't think about within the hours, what am I doing?
Yeah.
I have so much on my plate. By 3 p.m., 5 p.m., whatever time you get off, I have to have all these things done. And when I don't, it carries into tomorrow, or I'm taking it home, or I can't get it off of my mind. You know what I mean? It's really heavy. It really, burnout is really serious. And I think I've learned that, hey, I got to talk to you guys about this. I need you guys to come up with a toolbox of like your self-care, how you keep yourself safe when you feel yourself becoming overworked. You know what I mean? Because that's important. And everybody's going to have bad days. I'm not here to say like there won't be days where you're like, ooh, I am over it. There will be. But the reality is you cannot stay in that place for so long that it just hinders your ability to do the job that you have to do.
Yeah.
You know what I mean?
Yeah. Okay, tell me more about, because I want to talk about this part too that you're describing of like different people either having totally different approaches within, your supervisee group or just having different things that work for them. So tell us more about how do you approach the group setting? How do you navigate, okay, we're all together at the same, because you see your supervisees in a group, right?
Yes.
So how do we navigate kind of meeting all at the same time? Everyone's sort of different, but we all need to kind of, figure out these individualized approaches to the same thing.
That's a really good question. So interesting. So I read an article, right, when I was doing the course to be a supervisor. There was this article, and I was trying to find it so that I could tell you. And, of course, I looked through everything. Yeah. And I know when I leave here I'm going to find it. Right, but anyway, it talked about doing like an inventory assessment with each individual person. And I was like, well, why? And as I kept reading, it talked about being able to have an understanding of the person that I'm teaching, right? And I can teach a general idea, but if I want to individualize as much as possible what we're learning, I have to get to know you. So a part of my ability to do that is doing individual like assessments, if you will, with each of them to talk about. I mean, my assessment is very detailed. It gets into like your business, right? Well, and that's because for the next 2 years, we're going to be working together to kind of get you to a place where you can do this on your own. And so I need to know some of the deeper things about what you've got going on so that I can help guide you through when it shows up in the work that you're doing. So to individualize it, I do that. And then another thing that I feel like I do, and this might, I don't know how this is going to sound, but for me, right, I feel like I'm a good like reader of like people, right? And the moment I notice that something is off, I'm like, I'm going to address it, right? Like I'm going to say, hey, I realize that this session you didn't talk. And it's really hard for me to assess how you're doing if you're not talking. What is that about? And so I try to just take inventory of how each of them show up as best as I can. As far as getting everybody on the same page, there's a point where I also have to draw a line in the sand, right? I'm not going to be able to appease everybody all the time. And that means that I will be flexible when I can, but I have to set boundaries with, like, this is when we will meet, right? Not can we. Sometimes it's this is when we'll meet, and if you can't come this time, we'll work it out for the next time, right? So I have to take that stance, and that's really hard for me, actually, because I do want to please. You know what I mean? I don't want them to be mad at me, if you will. But at the same time, if I don't, we get back to that burnout thing. Then I'm like having my hands in so many places, trying to make everybody happy, and I'm suffering. So a part of this is a demonstration, too, for them to see, like, hey, well, if she can do that, I can do that too. You know what I mean? So hopefully that answered your question.
Yes, and gave me like 5 more. But,
of course.
But I feel like you're in doing that. You are modeling okay, not only teaching, but I'm modeling too. And like, even if it is uncomfortable for both of us, here's actually the benefit of this boundary for both people in the long run. Because then they also know, yeah, like I'm safe with you because I know that if you can't do something, you're gonna say you can't do it. Like,
Right.
so that it actually builds trust even within the discomfort.
That's a good point. It does. And I actually, realization moment. That's true. It does. And I hope that it creates like an avenue for us to have open communication throughout. You know what I mean?
Yeah.
And that can be hard. It's hard to, especially if you're a quiet person or an introvert, it's hard to answer. And that's another thing. I know my personality is strong, right? And I'm very upfront about that. I'm very like, hey, this is how I am as a supervisor, as a person. So let's make sure we align, right? Creating contracts, doing all these things, because when you don't do what you agreed to do, I am going to call you out. And when I don't do what I've agreed to do, I want you to call me out.
Yeah.
Let's hold each other accountable, because that's another part of what being a social worker is.
Yeah.
Accountability in what we do. You know what I mean?
Yes. Well, and I'm glad you're talking about this relationship between like you and the supervisees, or you're just yourself as a supervisor and supervisee, because like you mentioned, it's 2 years. So you know when you start, you're getting into a 2-year relationship. And it's so, the fit is important, which then gets into right away, right off the bat, you might already be having to have hard conversations. Okay, let's just talk about that 2-year relationship. Like, I don't know, do you feel like it's different between a supervisor and supervisee versus, social worker and client? Is it similar? Do you not really think about it until, is the time just going?
You mean in terms of the commitment?
Yeah.
Well, I guess I do think it's different. I thought about this question too before coming, because it's a harder one, right?
Yeah.
They're very similar in a lot of ways, the relationship, as far as my role, right? Because in both aspects, I'm with clients, I'm more so working on wellness, healing, right, processing.
Yeah.
And I'm kind of doing the same in supervision, except the objectives are different, right?
Yeah.
Like I feel like in supervision we are working on developing the supervisee. And so I guess I don't think about it as much. I just know when I'm doing one and when I'm doing the other.
Yeah.
And sometimes I do have to put on a little bit of a, supervision is not therapy. Let me just say that, right? But there are times when I do have to go to a place of like, hey, let's talk a little bit more about this thing that triggers you, that shows up, right? And I guess in the aspect of 2 years, it's, I mean, it's kind of like it is what it is. I don't really think about the time as much as I'm thinking about, are we doing what we need to be doing within the time?
Yeah.
Does that?
Totally.
Okay.
Yeah. Yeah.
Okay.
Well, and I like how you're describing it's interesting how you're describing the way, that nuance of you're getting your own sort of felt sense, like you just sort of know, okay, this is how I'm going to guide you through thinking about your own stuff and how your own stuff is showing up in the work. And also, there's still just going to be this boundary that we're going to bump up against, and we're just going to know it when we feel it. But I think this is another aspect that you can't really find anywhere outside of supervision is, well, I'm sure you can, but it's a great place to find in supervision of where is my own stuff? How can I work on my own stuff not affecting the work? And have that just actually very specific lens on it. Right.
And that's hard.
Yeah.
That is, I mean, because it bleed, like things bleed over, you know what I mean? And I don't mean like it has to come out.
Yeah.
But I mean, you can feel, you know what I mean? When something, when you're triggered, when right, like the person you're talking to sounds like gosh, you sound like my mom when I was 5. You know what I
Yeah.
mean? It comes up. And so it's really hard.
Yeah.
It's hard to like navigate that space, but that's why it's important, because sometimes and I'm going to go to another level here. Sometimes it's subconscious. So you don't even realize it's happening until
Yeah.
somebody else points it out, which is why I think it's important to like talk about in supervision.
Yeah, yeah. Well, and as always, I'm glad you went to the next level, but I think it's like maybe even often subconscious, like, and it might be one of those times where, you know,
This. Oh, sorry. My bad.
It might be one of those things where you don't even realize it's connected to countertransference. Like, okay, for instance, like if they're talking about in supervision, well, yeah, I just noticed that lately I've been always cutting a conversation with a client or a patient 5 minutes short. I don't know why I'm doing that. And so sometimes it's just not that deep, and sometimes it's like, well,
Right.
what's really coming up for you? Like, are
Yeah.
you feeling like you're in trouble and you got to get out, or whatever it might be. Okay, so you work with that in a group setting, and then the other people, it's normalized for them too.
What do you mean?
So like, I'm just thinking about how helpful it is to do these things in a group, because that way there's no, let's say someone is saying like, yeah, I don't know, there's something I've been doing, I'm not sure why I'm doing it, or they know I'm feeling burned out, and then you can work it out with them. Everyone else
I see.
feels like it's okay, like it's normalized. I'm not doing something wrong if I'm feeling triggered.
Right. So you're saying they're learning from each other.
Yeah.
Yeah. I absolutely. And I think that's the great part about group in so many senses, right?
Yeah.
Like you can not feel so isolated, like I'm the only person in the world. And sometimes that's what it feels like.
Yes.
I'm the only person this is happening to. And that's a silly thought, but we all have it.
We all
you know what I
have it.
mean?
Yes.
And they absolutely, I feel like in a group setting, you're able to kind of see, there's almost like a mirror, like, okay, I'm not the only person. Like, you're doing this too. And there's that thought like, oh gosh, I did this too. You know what I mean? It's both. For people who realize and people who don't. I think it happens.
Yeah, it's just that connection, that shame resilience. Oh my gosh. Okay, so I want to go back to being in an ER setting. Knowing that you have these parameters. You're, it's crisis. Like, you just kind of know that off the bat. And somehow you've got to go in, make a connection, offer that leg up in whatever way it is, and then know that you might not see them again, or you don't know how it's going to work out. I don't know. Can you just tell me more about that?
Yeah.
Yeah.
Are you asking me to tell you how I feel about like not knowing the outcome?
And maybe even just that like it's crisis. You have to sort of get in, and even in the crisis, kind of make this connection. Like, I don't know, just either the process of what that's like, or what it's like. I mean, supervising people through it, because it's not a setting everyone's familiar with.
Okay. This is a layered question that I feel like is going to be a little bit of a challenge for me to answer, only because I don't know that I fully. Tell me if I'm not answering your question. That's what I'm getting at.
Okay.
So in general, I think being in an ER is, man, until I was in it, I didn't get it. You know what I mean?
Yeah.
There's so many different things that you see. I mean, from traumas, right, to just people obviously having ailments. And I mentioned our population is generally indigent. So we're working with people who are typically unhoused, have no medical insurance, oftentimes are not citizens. Just lots of different complexities. So I feel like you have to be able to know, like, this might be the only opportunity that you have, right? To help this person. You may never see him again. You might not. So you go in and you this is where we do an assessment. This is where we're talking about, hey, what's going on? How can we help you? And don't get me wrong, you have people who come and they're like people who always come to the ER because they know this is where I can get food. I don't have anywhere else to go.
Right.
But in general, for people who aren't in that category, I think you assess them. You determine, hey, what is immediate, because ER is not a place. We're not a community social work service.
Right.
We are attending to your immediate needs. And the hardest part that I've noticed for me and for some of my supervisees, housing, right? Because like people should have, like, you know what I mean? Like it's just an automatic basic need.
Right.
And so we want to resolve housing, and 9 times out of 10, it's just not something we can resolve. Yeah. And then we talk about resources. Yeah. The resources, they're so limited, and you have to be okay with, like, this is what I have. And that's hard. Yeah. That is so hard, because sometimes you don't feel like, you know, you've done a great job, right? Because what you have isn't even meeting the need of what the person is talking to you or asking you for. You get what I'm saying? Yes. So it's very complex, because then we have to talk about that, right? Because of your resources doesn't make you a bad social worker, right? It's just, this is what it is. Yeah. And we have an opportunity maybe, right, is there something within your day that can stretch or make this better? You know what I mean? If we know this particular shelter accepts people from this time to this time, how can we maximize that? Because that's all we have. We cannot create another shelter. We cannot open a shelter that's closed. But with what we have, what can we do? And if it's nothing, we have to come to an acceptance of that, right? And so that's a hard one, and we talk about it. And
I feel that in my whole body.
Yeah, yeah.
With what we have, what can we do?
And that's really all we have control over, you know what I mean? And that, don't even get me started with, like, what we can control, because that's a whole nother level of, like, a beast. So
you know, I want to get you started.
I know.
But LaSondra, I feel like that just, even that phrase, with what we have, what can we do? And sometimes it's nothing, and we accept that. I mean, that is like, just, I mean, it's powerful. It's, again, something I think we don't learn in school. It's only something you know when you're in it, like you said, when you're actually doing it, when you're in the situation, and it makes me think about so many things. Like, one, about burnout, like how learning and teaching that process, how can you have that heavy feeling, that heaviness, and keep going, and know that it still matters even when it's nothing or when it's little.
Yeah. It's a lot. It's hard, but I mean, don't get me wrong. There's also so much reward in when you get those patients that, gosh, we were finally able to get something. Yeah. You know what I mean? And so it balances, but you have to know that it won't always. And you have to be okay with that, because what's the alternative? You know what I mean? Like, it is what it is sometimes. And that's a hard place to be in, especially as a newer social worker, right? Yeah. It's like you're going in like Superwoman or Superman, and you're like, hey, I'm about to save the world. No, baby. Let's slow down. Let's get through today. Let's get through this minute, right? Especially in an ER. Yeah. Because it's like constant. It is constant.
We're going to have to take a minute and just feel it, you know?
Okay. Yeah. Yeah.
And I mean, I think you're saying so many things within this, like recognizing the small wins, you know, or even not wins, but just recognizing the day-to-day, the minute-to-minute things that maybe aren't saving the world, but are saving something, are doing something. And that, I mean, I can't even imagine a better place than in supervision to be able to come and just let it all out and say, you know, I felt like I didn't do anything today, or I feel like I'm working so hard. And, you know, then this new policy comes out that just takes it all away. Or so even just to be able to come to the group and to you and work through that, like vent through that, or just have that feeling and know that that's what social work is kind of made for, is, you know, we're going to do it in the real world and not just in, I don't know, books or.
Right. It's what came up for me when you said that was like, I think about even when supervision is over, right? And this is why I do the thing at the beginning where we do the assessment, because you have to have a place to take that.
Ooh, say more.
Like, you have to have a place. This is just the beginning of, like, things maybe not panning out all the time the way you envisioned, right?
Yeah.
And so you have to have a place to come back and say, supervision is where it is maybe right now. To say, like, today was just one of those days. I saw 5 people, and out of all the 5 people, none of them were able to get, the, you know, whatever.
Yeah.
What do you do after supervision with those experiences? Yeah. How do you process, right? And you're, of course, hopefully you're getting the tools to process through that.
Yeah.
But sometimes we need a community. We need like other social workers or other professionals who can help us to kind of like get through those moments, because we'll have them. And I don't always. So this is tricky for me. This is personal, what works, right? I realized that maybe this person came in for one thing and I wasn't able to give them that. But what I was able to give them was my time. I was able to give them, like, love in a sense, you know what I mean? Care, compassion, empathy. These are things that I was able to give them that if they hadn't come here and if we hadn't crossed paths, maybe they would not have otherwise gotten that. And so I try to find, right, like the silver lining in these things, because it's hard when you know it's not happening. So you have to try to find like the silver lining. Does that make sense?
Yes, I'm like trying to pick myself up off the ground. You're going to have to give me another minute.
Okay. Take your time.
You know, it makes me think of, I think that's, again, super powerful and such like a important thing to be learning as you become, you know, a clinical social worker and whatever you're going to do with that. But like, it kind of reminds me of, you know how you learn the hierarchy of needs or whatever, and like it's housing and food, and then it's, you know, the next things. And I feel like you guys at the ER are working with that all the time. But it almost makes me feel like sometimes that should just be flipped. Like the attention, the love, the care, the time. I mean, that's just as much of a basic need as anything else. And it's really not second best. It's just filling a different basic need.
Yeah, that's true. That's true. That's a good point. They're all the things that we need. But I also think of it as like, this is what I can give. Like, this is what I have to give you. This is what I can control, in a sense, right?
Yeah.
And that is hopefully where you draw strength, or I draw strength from, because this is what I have to give that I can give. I can give you resources, sure. But if it's 5 o'clock on a Friday, I'm already knowing where we're going with the resource packet that I'm giving you. You know what I mean? So I need to take it a bit further and feel like, okay, this is really where my power is. Does that make, you know what I mean? Like, this is where I can make more of an influence. Not that resources don't help, not that but this is what I have a little bit more control over. And maybe it's even more impactful when we think about flipping that hierarchy, like you said.
Well, and I feel like another thing, and maybe we've already said it in different words, but it seems like another thing you're giving your supervisees is just a way to like both be a human
Yes.
and a social worker.
Yes.
You know, like really know that, you know, that it's actually totally okay for Friday at 5 p.m. for you to just take off the hat and be like, I've done what I could do. It's harder than it sounds.
Yeah, no,
Yeah.
100% it
Yeah.
is. And like I said, when you go in, when you're like first starting, I used to be like, what? I'm about to find a shelter. And it's like, baby girl, you've been looking for 6 hours. It's no shelter. You know what I mean? But it's absolutely understanding that at 5, this is what you've done. This is what you could do, and being at peace and okay with that. And if there are qualms, taking, right, like I'm big on give yourself 5-10 minutes to sit in whatever it is you're feeling. And after those 5 or 10 minutes, it's time to push forward. We gonna, because staying there is not gonna be productive. And so, yeah, I feel like we talk about that a bit in supervision. Because again, it's one of those practical things that maybe until you're in it, you don't realize
Yeah.
that is something that comes up.
Yeah. Well, and the skills involved in being able to give yourself those 5 or 10 minutes. Like, you know, that is another one of those things I think you were describing that's so different for everyone. Like, how do you actually, like when that 5 minutes is up, how do you actually then switch out and keep going? Like, you know, I think some people literally do like a timer sometimes.
Yeah.
I'm like, I'm going to cry until that timer goes off and then I'm going to get back in there or whatever it may be. Or
Yeah.
I'm just going to sit here and stare at the wall until that, you know.
Whatever you do with
or
your
other
time.
people just visualize like, okay, let me visualize this space and then I'm going to visualize the next space or something like that. Like these are those, I don't know what we call them.
Like steps, techniques,
yes,
tools, things.
to not only prevent burnout, but also just to,
Preserve yourself.
yeah, yeah,
100%.
like those regulation skills you don't even know you're going to need until you need them.
Right. And then I think there's skills just applicable, right? Like we're talking about supervision, but these are like life skills
Yeah.
too. You know what I mean? In general. So I feel like supervision is all encompassing. You're obviously learning about kind of developing clinical skills and those sorts of things. But I think there are other, well, I think that about most things. There are like more lessons than just what the eye sees, you know what I mean, in what you're doing.
Yeah.
And so I think for me, I think I'm about that, right? Like, so I want you to see on a broader scale what all we have to work with, how all of these things we're doing can be applicable to you as a social worker, as a human, as a mom, as a wife, as a sister, you know what I mean?
Yeah.
So, and that's just personal. That's not like all supervisors don't, it isn't a standard. It isn't like the golden rule.
Right, right.
That's just my own kind of thing
Yeah.
that I'm in the groove of doing. And I like it. I like it because I just think it helps you to be more efficient and well-rounded. You know what I mean?
Yeah, because if you, I don't know, like, yeah, if you're also learning and growing in your personal life, then you're more likely to be able to kind of keep going in your work life. And like we said all the way back at the beginning, have it not bleed into the work and what you're doing.
Right. Exactly right. Exactly right.
You got to give me sink-in time.
Okay. Listen, I'm patient. I am patient, for sure. You take your time.
That's true. I want to go back to what you said about we need community.
Mm-hmm.
I feel like that's another thing that's just layered and can be a lesson for supervision, but also just life, the world. I'm not even sure I have a specific question here, which I know you'll love. But can you just, I don't know, can we just say more about that need for community? Because again, I feel like it's something, you say it and everyone kind of, agrees, nods, but we don't always really, we can't always really find it or have it, or we don't know what's the first step. How do we go about finding this thing called community? Where do we start? Is it starting with professional help? Is it starting with, just coworker help? Is it finding, because I remember finishing supervision and feeling like,
now what?
I'm kind of glad, but also can I go back? I kind of still want it. So I don't know. Let's just talk more about what does that look like starting to find what community support looks like?
Sure. So I think one of the things that I would maybe suggest or encourage, right, like my supervisees to do in terms of community is you want to be sure that you're aligning with people, professionals that share your values, right? Just because we're both social workers doesn't mean that we have some of the same values or work ethic, right? And I also think it's important to know people who aren't afraid to hold you accountable, right? There's that word again.
I know. I forgot I wanted to circle back to that, but yeah, let's pin it.
Okay. So in terms of figuring out a community, I think that's where you start. What's important to you in terms of, is it just being able to vent? Or is it being able to vent, coming up with a solution, people who are driven to problem solve and who you can rely on to give you efficient, accurate sort of feedback or recommendations. And what that looks like is, I guess, kind of who you talk to now, right? So, for example, you're in supervision with other professionals who are kind of going through the same goals. Is there anybody here that aligns with those things I just mentioned? You mentioned professional help, so I'm going to pivot a little bit. I am an advocate of we all need to do some therapy.
Yeah.
So I hugely say, I highly, highly recommend doing therapy because that person then can help to do all the things we've said before. Yeah. Community also might look like, as you're networking and as you're meeting people, as you're in the professional world, you may make those connections. And you might say, hey, maybe me and you can kind of do some work together. Maybe it comes as you're kind of working through. You can use some of the people you know now, and as you grow and as your career continues to grow, you meet people and they become a part of your community. There are several ways that I feel like we've talked about in supervision and in general of how to kind of grow that support. Again, I think you start within. What are your needs as a professional, and what do you really want? You know what I mean? Out of your community.
Yeah. Yeah. Well, and just that importance of it, and guiding them, and really all of us kind of guiding us to okay, start with our values, and then sort of go from there and build from there, and do both. Get some venting time, and then know when it's time to go get a therapist. Okay, yeah, I'm glad that word accountability came up again, because I feel like the first time you used it, it was in this larger context of the social work field, being a social worker, and how accountability goes into that. And then this time it was kind of how you find in your personal relationships getting accountability. And I feel like, again, let's just talk about it. Let's just say more, because it's nuanced. Sometimes you just kind of naturally get it. When you have a friend or a coworker, whoever, who's going to be able to hold you and say like, you know, what's going on for you that you're doing that? And sometimes it's harder. You know, there's more barriers, there's more blockers to doing that, and you kind of just want to say like, yeah, great, you know, keep going, or you just want to not have conflict, or maybe even on the macro level, like within the social work field, like it's just feels too big or too overwhelming to figure out what the accountability markers are. So I know these are two things, so we can go into the personal or the professional, but just I feel like it's nuanced, and it's hard to be someone holding someone else accountable, and sometimes it's hard to be held accountable, and it's so important.
That's interesting. So I feel like there's layers to that.
Yes.
Because a part of me wants to say it's not really that hard, and then I'm like, no, girl, it is kind of hard. For me, right?
Yeah.
I'm really big on accountability. Like, I want to hold people accountable, and I want to be held accountable because I just feel like it deepens a connection, right?
Yes.
And so in supervision, that is why I do try to model sort of that accountability piece. And it is really hard. But in other ways I offer, right? Like, hey guys. So for example, I have a thing where I have my supervisees do documentation. And I went on a vacation and I got behind on my documentation, right? And so I said to them, you guys, I realize that I've made a mistake and I'm behind on the documentation, and I apologize, right? And this is like, this reality is I'm behind and I'm wrong. And so I had to hold on to that. I had to admit it. And of course, I don't expect them to be like, you are just, you know, I mean, if they did it, they did it. But I didn't expect that. But it was for me to just say, hey, if I'm going to hold them accountable, I got to do my part too. You know what I mean? And in personal, I have people that I know, no matter what, they're going to be like, hey, you get it together. Something's not right with that.
Yeah.
And I think, again, that's why therapy comes into play, because sometimes I'm able to do it for myself. I know that is not me. Why am I doing this, right? Or how is it that I fell short in this area or that versus that area, whatever. I think I talk to my supervisees a lot about, like, do some self-reflection sometimes too, right? Do some self-inventory of things that maybe have changed for you. And then you take that to people that you can trust. Now, accountability is not easy when you're dealing with somebody that you feel like is judging you, somebody that you feel like is going to hold it against you, where you're not safe.
Yeah.
You know? So I think accountability comes with safety.
Yeah.
And in both worlds, professional or personal, those two things have to be there in order for accountability to, like, come to fruition, if you will.
Yeah, yeah. And it's kind of it builds on itself. Like, the more you're verbalizing your own accountability, you're creating safety for them too. Okay, well, I know I'm keeping you a long time, but it was just too exciting.
Yeah.
But thank you again for coming on Like Therapy and just sharing what supervision is like, what social work, hospital social work is like, what all, you know, how we can all keep going in this field. Just can't wait to have you back.
Yeah, thank you so much. I'm happy to be here. Thank you. I appreciate it.